Today we will talking about carpal tunnel anatomy, all tips and tricks. We will start with hand bones. We have phalanges, metacarpals and carpals. The carpal bones we have in the first row scaphoid, leonate, triquetrum and pisiform. We have in the second row trapezium, trapezoid, capitate and hamate. We have mnemonics to remember the carpal bones. She looks too pretty, try to catch hair. She looks too pretty for the first row. S for scaphoid, looks in leonate, 2, 3 for triquetrum, and P for pisiform. The second row try to catch hair. T for trapezium and T for trapezoid, catch C for capitate, and H for hamate. And those carpal bones will form the floor of carpal tunnel. So what is the roof? That is the roof, which is a ligament. It is the transverse carpal ligament. In this section, the ligament is between pisiform and trapezium. It converts this area into tunnel. This tunnel contains tendon and nerves. The tendon is flexor tendons of the finger, which is flexor digitorum superficialis and flexor digitorum profundus, and a flexor tendon for a thumb, which is flexor pollicis longus, and the nerve is the median. Again, in this picture, we have the transverse carpal ligaments and the tunnel and its content of flexor tendons and median nerve. The median nerve has motor and sensory supply in the hand. We started by the sensory supply. It supplies the radial side of palm of the hand, the radial side of palmar 3.5 finger, and the nail bed of those fingers. The motor branches of median nerve of the hand for thenar muscles, which is flexor pollicis brevis, abductor pollicis brevis, and the opponens pollicis, and motor supply to first and second lumbricals or lateral to lumbricals. We have two important branches of the median nerve. We should know them as they have clinical importance, which is recurrent motor branch of median nerve and the palmar cutaneous branch of median nerve. Try to find the palmar cutaneous branch of median nerve in this photo. Yes, it's alright. It is the branch which lie superficial to transverse carpal ligament, so it isn't in the content in the carpal tunnel. It lies above the transverse carpal ligament. It supplies this red area of the palmar skin. So in carpal tunnel syndrome, this area not affected as the branch lies superficial to the transverse carpal ligament. It's a very important note. Second is recurrent motor branch of median nerve. Try to find it. Yes, it arises from the median nerve after it passing below the transverse carpal ligament. This recurrent motor branch, we call him the nerve of median tower. It supplies the thenar muscles, which is flexor pollicis brevis, abductor pollicis brevis, and the opponens pollicis. So as we said, it arises from the median nerve after it passing below the transverse carpal ligament. So in long-standing cases of carpal tunnel syndrome, this recurrent motor branch is affected, causing thenar muscle atrophy. This recurrent motor branch has three variants. The first one in picture A, which is extraligamentous. It arises away from the transverse carpal ligament. So in the surgery of carpal tunnel syndrome, we release this transverse carpal ligament, recurrent motor branch will not be affected. In the second picture of P, the transverse, the recurrent motor branch is subligamentous. It's near to the end of transverse carpal ligament, so it may be affected. In big C, the recurrent motor branch is intraligamentous, and it carry a high risk of injury in carpal tunnel release surgery. Thank you for watching.